The lab facilities are excellent. The faculty ratio is incredible.
I think it's one of the best courses in terms of quality worldwide.
It's top ranked, even in the best place in Europe. It's really comparable.
It's an incredible opportunity.
The skull-based course that I started here in 2015 brings senior residents with special interest in skull base, and they get that intense exposure to experts in the field from both ENT and neurosurgery.
I think that having the one-on-one partnership with an ENT resident from another institution, but at a similar training level, is awesome because you get that other perspective. So throughout the dissections, you're bouncing ideas off one another, hearing about the way they do it at their respective institutions.
We have a very large faculty of different people from all over the world. And by discussing the different approaches, the young neurosurgeons can learn a lot out of it.
I think it's the most diverse course I've been to. Certainly faculty from not just the United States, but across the, globally. And it was interesting to see, how they talked about and discussed different ways they approach surgeries. Being part of that discussion is helpful and eye-opening for us as trainees.
The fact that we're on almost a 1-to-1 ratio is just, to me, unheard of. And these are all, experts in their field who are just, constantly circling around the dissection lab, giving you comments about what you're doing, or you're able to ask them questions.
In order for a neurosurgeon to learn how to do these approaches, they have to learn that in a controlled environment outside the operating room, not on real patients first. And that's what brings those hands-on cadaver courses to be like the main educational tool.
We see that due to the resident work time restrictions, the exposure in the OR is diminishing, and therefore we need to compensate somehow with this lab training.
Working on cadavers is really reliable, and it's comparable with what we are doing in real practice, particularly for skull base, because we are working on the bone, we are working on the dura, and these structures are not modified by the fact that this is cadavers. This is the same in real patients, which means that the equipment is top ranked.
The lab has to be equipped exactly as it is in the operating room. And that's not doable any course in the world. But we do it here. You have the microscope, you have the endoscope, you have neuronavigation, you have all the microsurgical instruments, everything that you will be using in the operating room is there.
This makes it much easier to be very close to normal surgery in the OR. If you train just with loops and no navigation, no endoscopes, no microscopes, it's completely different. You really do not connect what you learn here with the daily work in the OR. And so it has to be as close as possible to real surgery.
The newest facility is probably the best facility I've seen in the country. The way it's set up, the lighting, the lecture room right next to it, the venue layout, it's an amazing place. Just to be able to walk across from the dissection laboratory and back to the lecture hall. The most unique aspect of that is just the spontaneous conversations and learning that it creates.
These are complex approaches, and they're very diverse, and we combine all this diversity in one event so people listen to all different schools of doing skull base and adopt some of them or all of them.
To represent minimally invasive, full-on skull base approaches, to not neglect any corners of what we do with craniotomies. I think it's a really cool setup.
This year as well, we're so grateful that Dean Riley came and welcomed our esteemed faculty and participants himself at the first day of the course. So that was very well appreciated, and we're very grateful for that level of support.